Hi everyone, thanks so much for having me today. My name is Lee Milligan. I'm the CEO of MQ Mental Health Research. It's really fitting that I'll be talking to you today about workplace mental health at the very time that furlough is beginning to unravel and unwind. And I think somewhere in the region of 1.5 million people who are still on furlough will be eagerly awaiting and understanding what their future looks like. And as we come out of this phase of the pandemic, hopefully into a process of seeing COVID become endemic in society and then slowly retreat back, I think there's a real opportunity for employers of all sizes to really reflect on how they want to operate and do things differently, and how mental health can be at the front of the agenda in the workplace. And I think there's real advantages to exploring that conversation. So let me share a little bit about what we're looking at MQ Mental Health. So I want to introduce you a little bit to who MQ are, where we think we're at in society with workplace mental health, a little bit about the research that we're planning and what maybe the future might look like, and hopefully that'll spark some conversations that we can have some questions around. So if we zoom right out initially, the problem or the challenge, if you like, is that 1 in 4 people is affected by mental illness every year, and that is a diagnosable mental health condition. And that rate is increasing year on year. In the recent NHS digital study, the number of children and young people with a likely diagnosable mental health condition has risen from 1 in 9 to 1 in 6 in the space of the last 3 years. And so that flows through the rest of society, because mental health conditions are normally diagnosed 75% of the time in under 21s in the first instance, and move forward from there. So we would talk at MQ about the idea that while we've had the COVID pandemic, there has been this underlying epidemic, or a pandemic in its own right, of mental illness in the country, and something that needs to be tackled. And the solution, MQ are part of leading the sector and convening the sector to understand how we can do more. And we're the largest charity in the UK dedicated to tackling mental health through research. And our vision is to create a world where mental illness is understood, effectively treated, and ultimately prevented. And that, for some people, will spark a whole range of questions around mental ill health. But without an ambitious understanding of where we could be in society, we're not going to take grounds forward. We believe that research has to be at the very core of all that. So where are we today in terms of our understanding? So despite affecting nearly a quarter of the population, less than 6% of the UK's health research funding is spent on mental health. And that funding has been flat for the last 10 years. This comes from a landscape report on funding that we carried out twice in the last 6 years, and an international version of this has been pulled together, which has a similar representation across the world. The UK is actually the leading mental health research funding organisation in cost per capita, and yet still represents a very small proportion of research spend. And to put it into context that might be understood, about £9 is spent on research per year for each person affected by mental illness. That's in comparison to over £200 per person impacted by cancer. And we know from WHO research that by 2030, the single biggest burden of disease globally will be depression. And that's despite pandemics of COVID going on. And so we're on collision course for serious impact for our whole society. And yet our spend against that is astronomically low by comparison. If you look at service delivery, then only £1 in every 100 is spent on direct mental health services in the NHS. And so we've got this underfunded landscape of service provision, this underfunded landscape of research, and an ever-growing and increasing problem. And MQ is trying to tackle that by investing in research all over the world. We last year had 44 live projects across 6 continents, looking at a whole range of different aspects of mental health research, from basic biological understanding through to translational impact. So looking at what real world solutions we can provide in various different mental illnesses. And we have 3 focus areas that we believe we need to tackle. This year's theme is thriving in a post-pandemic world, and we've really been investing into understanding the next steps for mental health for children and young people, workplace and mental health inequalities. We'll be launching 2 more themes in the next 2 years. Gone Too Soon, which looks at reducing the mortality gap caused by early death by suicide and the interplay between physical and mental health. We would talk very much about this idea that we have to take, from a research perspective, a biopsychosocial approach to research, or another way to look at it is, what's the interaction between mind, body, and brain, and recognizing the interplay. And the third theme that we're launching in a couple of years, Out of the Shadows, is looking for radical treatments for depression. So keep an eye out for those. So let's talk about mental health in the workplace. Where are we now, and why is research part of the answer? Well, in reality, if 1 in 4 individuals has a diagnosable mental health condition, then, add up the number of people that sit in your office around you, that work in the building that you work within, and you might be one of those individuals, but if not, then you definitely know somebody who has a diagnosable mental health condition. And in addition to that, we all experience stresses and anxieties and pressures in the workplace. It's where we spend a vast majority of our waking hours. It's where we invest a lot of energy and time. And in the last 2 years, we've had that entire model that we're used to societally for the best part of 50 to 60 years. The workplace hasn't really changed, especially here in the UK, and that has been turned upside down. And so, as we see what is essentially, an incredible opportunity for a before and after study to understand what the stressors look like and what causes burnout in the workplace and where anxiety and growing depression links are coming from. We've got this opportunity now to use research to drive very quickly forward our understanding of what we're doing. And so at MQ, we recognize that the burden of mental health conditions and the opportunity to use big data is there, and this is something that we can hopefully play into. So when we started out this journey, we wanted to do some listening, and at MQ we believe really strongly in listening to the patients, if you like, or the people with mental illnesses that we are trying to serve and help. So nothing about us without us is at the very core of how we try to think. And so we wouldn't go and carry out a study on depression or psychosis without talking to people who had struggled with those illnesses to understand what questions we should be actually asking. Far too often research is carried out for curiosity's sake rather than trying to answer a question that genuinely needs to be answered. So we started out by trying to survey organizations to understand where the gaps were in their understanding of mental health in the workplace. So we surveyed somewhere in the region of 50 organizations came back to us with responses of all different sizes. So we had organizations that are huge multinationals, right down through to sort of boutique-sized organizations with 10 or 15 staff. And this kind of summarizes the sentiment behind what was being talked about. Obviously, you can see there pulled right out is this sort of pandemic and hybrid working type of piece, the lockdown element, and how we're going to work with all of that work from home. You can see those themes come out strongly. But the other bit that came out really strongly is understanding the insights into mental health, the awareness of mental health in the workplace. How does workload and culture interact with mental health? And so while you've got this kind of strong nervousness or desire to understand what's going on because of the pandemic, there's always been this underlying desire to have insight and understanding of culture, awareness of mental health, and how the organization can impact that. And there's a number of motivating factors for these organizations when we spoke to them further. For some, this is about staff retention. For some, this is genuine desire for well-being for their people. For others, there is just a really clear, hard-nosed recognition that if you have a healthy workforce, your bottom line improves. You retain more people over a longer time. Your workforce develops and moves with you. It grows strength in the organization and has real benefit. And the different challenges for those organizations vary massively. If you're a large multinational, then you've got people who are based in an office, who are out driving, who are out delivering, who are out on the front line with customers, a whole range of different subcultures of the organization. And so there's no wonder that this idea of insight and understanding is really at the forefront. We then talk to this sample about the quality of their data, so how often they're gathering data, basically. And there was a real sort of mix and spread of when people were looking at data, with about 50% saying they were looking at some sort of well-being or mental health data quarterly. As we dug in to understand what kind of data and information they were using, the vast majority using employee surveys. There's obviously a mix there of sickness absence records. Third-party tracking tools weren't widely and massively used. And then EAP data, employee assistance product. So the phone line that your organization will have that you can ring up to say, I need help with XYZ. Those services provide data back, anonymized data on usage levels. And so this was kind of the blended mix of information that people had. And there was a group that weren't collecting any data at all in what they were doing. And so as we tried to unpick further what the challenges were that companies were facing, the outstanding piece was they just didn't know what to do as a result of the insights they gained. So they had all this data and what did it actually mean? The second biggest one was the tracking. Were they even collecting the correct data and collecting it correctly? And did they know how to gather that? Making sense of the data collected. So again, some organizations aren't even finding insights. They're not finding out that there is a core group of people that have a problem and then asking, what do we do about it? Like the first group, they just have a bunch of data and don't know what to do. I had one very large organization, an HR coordinator said to me, the problem is I present statistics to the board and they ask me to present these stats on anxiety and depression. And because I've run the survey for the last 4 years and it's got more and more popular and people have filled it in more, because I get more people filling it in, it just looks like anxiety and depression is going up and up and up constantly. Well, look, we know, wind it back. We know that's not how we manage data and understand it. We know we can scale and understand the data based on population samples, and the population sample size can change. That doesn't mean you've got an upward tick. And we've learned a lot about this as the general public, as we've watched, infection rates of COVID go up and people argue about testing rates being a percentage tracker against that. So you've got the real challenge of HR specialists, people that are there to change policy, drive culture, and show real compassion, not having the data analytics skills or tools that they need to then do something about it. And for a small group, they said that the challenge was, how do you actually change culture? The survey was very focused on understanding those, so I'm not surprised that one came out quite low. And then we kind of just asked people, what would be the most useful output if we were to set up some sort of workplace mental health challenge fund, because that's the kind of style of what we do. And so this was kind of the results of that survey for those organizations. Guidance on the efficacy of various interventions. So literally, what should I introduce to my company and what will work? Guidance around what data is useful to collect. So answering that question about what they should be doing. Support with analysing the collected data, big chunk there, and then advice around interpreting the results of analysed data. So, a really strong set of results in terms of wanting to see a research methodology built in to what companies are doing. And, companies make huge financial decisions based on really rigorous assessments. And yet when it comes to staff well-being, decisions are often, and big checks are written on a whim. I spoke to one very large organization that said that they were giving all of their staff access to a mindful app, a mental health app, a relaxation app, whichever one it was, whichever brand it was, at a cost of £70,000. And I said, that's wonderful you're doing something for staff. Why have you chosen that? And they said, well, one of the directors used it and they really liked it, so we're rolling it out to everybody. And so And that's one anecdote, but there are plenty more examples like that. And it's almost like for companies, mental health and well-being of staff for many is I describe it as it's like what corporate social responsibility was 15 years ago in a company. So 15 years ago, a company would write a check and say, we've donated £5 in your name to the Royal Ballet. Aren't we fantastic? Aren't we a great company? Now CSR is much better understood. It's about true partnership. It's about seeing how you can leverage volunteer hours into an organization. It's about how you can raise money together. It's how you can understand the cause. It's how you can really partner and embed together with organizations. And so mental health and well-being, we've given you an app. Why? Because a director thought it'd be great. £70,000 is a lot of money to invest in the well-being of your staff. And there's not even a tracking system to understand if they're using the thing, whether or not there's efficacy to it. And so that's a real challenge. Now, for those interested, the Wellcome Trust have put out a commission last year that started to test the efficacy of some interventions. So interventions like how much you sit in your seat and various sort of team engagement and the engagement of a mentor with young people type programs, and looked at what research is out there to map what the efficacy is of some of those. And they've just released a second commission where they'll be looking at 7 or 8 more elements of that. So if you're interested, go to the Wellcome Trust website and have a look at their workplace mental health work on that. We've taken a slightly different approach to that to complement what Wellcome are doing, and it's this kind of data-focused approach. So we set the vision for us to try and achieve the challenge that by 2030, no organisation will be without a research-focused workplace mental health framework. So really putting a data capture, data-driven, insight-driven approach to mental health, much in the way that health and safety has moved in the last 10 decades up the ladder of importance. We want to see the same thing happen for workplace mental health. And the way that we think we can contribute towards that is by launching a workplace mental health challenge fund. So a big part of what we do has been in driving data science, and we convene the UK's data science sector biannually, and have just been commissioned by the UK government as part of a consortium to set up the country's first mental health data hub that brings together all regularly collected data on mental health to make it interoperable and visible for research. DataMind, if you want to go Google that piece of work that we just launched. So we know we're strong in this space. We also know that putting the public and patient involvement at the very heart of what we're doing is crucial to what we do. We've historically invested in early career researchers who are the brightest and sort of most exciting minds in the UK to work with, and we're very used to collaborating and partnering. And so we kind of pieced all that together to look at this workplace mental health challenge fund. And the idea is that we're looking for a minimum of 5 organizations to come together to work through a data framework model, collecting data from their staff through a framework that we're going to develop together, and then use that to develop the proof points of what is the most important data and how do you garner great insights. And the impact of getting that right has individual, organizational, and a societal and research community impact. One organization that's done this really well already is Accenture. And if you get a chance to look at some of their work, I would encourage you. They did a really interesting piece of work during the lockdowns to find out which groups of staff had were having the biggest impact, which staff the pandemic is having the biggest impact on in terms of well-being and mental health. And that piece of research that they did, that survey research, pulled out some really interesting groups for them. So the first one was women, and we know that nationally that's been the case as well, that women who have got caring responsibilities and jobs have suffered in terms of mental health much more than men in the same scenario. And that's sort of systemically endemic within our society, and here's another proof point of that. The other 2 groups that came out interesting were those with other caring responsibilities, i.e. for a member of the family who was ill or sick. So when you can see a child or a pet running in the back of a Zoom call, what you don't see is an elderly relative or an ill relative that you are a carer of. And so that particular group, and Accenture's, a huge organization, so had a big cohort of those individuals. They had the same levels of mental well-being, stress impact in those that had kids, but it was invisible because it wasn't on the background of the Zoom call. And the other group that came out as significantly poor results were senior management, where senior managers had historically, obviously, had rhythms, routines, and control and command models that they were used to. This sudden shift of the sands and uncertainty of the future and the inability to operate in the way they normally operated was causing significant additional stress. And so they then were able to roll out interventions specifically with those groups by asking those groups what they thought would help and then delivering and executing. But they have a really sophisticated tracking tools that they were able to adapt and alter, and they upped the amount of data they were collecting from I think biannually process to a monthly process during 2021. And so there's this one model. There are other models out there that are looking at different elements of well-being and mental health. And what we want to do is basically work with organizations to develop something that we think then can be open access and free access to everybody. And so when we look at what the future of workplace mental health looks like, it seems like every week we see a new company discussing the fact that, like Deloitte, everyone can work from home forever. And it seemed at one point the tech industry was saying the same, and then all of a sudden, big banks and trading floors said, no, everyone's going back into the office as soon as humanly possible. So it's going to be a pendulum, we know that for sure, and things are going to change and shift and move. There are questions that we need to try and answer about what the workplace looks like for those entering the workplace, those in their first jobs, those learning on the job, those understanding what roles look like depending on what the hybrid environment looks like. How do you foster, we know that we can have transactional relationships over Zoom, but how do we foster better creativity and better communication to move and advance projects forward in a more hybrid working space? And early on in the pandemic, a sort of mental model came out, I think from McKinsey, that essentially said, look, if the pandemic goes the way that some scientists are suggesting it does, and it has, then there are two axes that we need to consider for the future of recovery, or what the new normal looks like, or the future looks like. And let's take a 5-year event horizon. There is the recovery of the economy. So what impact does that have? Is that a slow recovery, or is that a fast recovery? And then there is the recovery of trust from society. So the trust society puts in government, the trust society puts in science and research, the trust that society puts in each other, the trust that society chooses to put in technology, and what's the trajectory for that. And so as we go on this journey of lockdowns, working from homes, furloughs, likely redundancies in the next 8 to 12 weeks within the UK especially, and organizations trying to work out all of the practicalities and finances of operating, we individually are still coming to terms with what this looks like. There's a whole cohort of people who cannot wait to get back into a building. There's a whole cohort of people who've been at work the entire time during the pandemic who are not office white-collar workers, who have a totally different understanding of what the impact has been on their work-life balance. And then there's a whole group of people who have been working from home who desperately don't want to go back because their trust in society, the virus, etc., is in a different place completely. And so with all those different cohorts and groups, the only way we can make sense of this is start tracking and gathering information to inform our decision making. And the last thing I'll say is we need to be really careful to recognize that not all stressors and not all bad experiences, if I can use that very broad phrase, are a negative driver on our mental health. The coping mechanisms that people have got and the ability to cope with those stressors and outside influences and negative experiences actually develop additional and continual resilience on the way through. And so in all of the conversations we're having, it's not simply about how do we make sure that no one ever experiences anything negative? It's how do we make sure that the right coping mechanisms, the right structures, the ability to raise your hand and say, right, I cannot handle that. That is now having a negative effect on me. And then for us to do something about that and to build that into what we're doing in a workplace is the absolute key. And if we get that right, if we get a data-driven research approach to this, we'll have healthier workforces, happier people who have a better work-life balance, and ultimately we'll see society tick in a better direction in terms of mental health. And as companies, we can move forward with a stronger workforce that are happier to continue to do what we're doing together. Thank you very much. Really happy to have a conversation and answer some of your questions or hear your experiences.